Hello everyone, my name is Yolanda Carter and I will be giving an oral presentation concerning adverse childhood experiences. Adverse childhood experiences, also called ACEs, are potentially traumatic events that can have negative, lasting effects on health and well-being. The experiences can range from physical traumatic experiences, emotional traumatic experience, or sexual abuse. ACEs come in many phases. They can be acute, which is trauma resulting from a single incident. They can be toxic, which results from prolonged trauma like domestic violence or abuse. And this abuse could be placed upon the child or a parent. Complex trauma is varied and multiple traumatic events altogether. For example, ongoing abuse of a parent being beaten in the home, a parent using drugs in the home, or a parent having addictions and or mental disorder. These all affect the child. When we think about traumatic experiences for children, we also have to remember that there are both abusers and those who are abused. The abused are children of all ages from infancy through the late teens, children from families of all income levels, children of all cultural and social backgrounds can experience trauma. The abusers can be anyone, children, for example, as bullies, adults, anyone. People in all walks of life can be abusers. People in all income brackets can be abusers. People of all cultural and social backgrounds can be abusers. Stats show 1 in 4 children has experienced a traumatic event in their lifetime. It is imperative that society become aware of the term ACE and create safe places for children, because when children experience any type of trauma, support is necessary to keep them mentally and physically safe. They also need to be physically healthy. A societal change across the country is occurring, but it's coming slowly because people are becoming more aware of the term. It is important that ACEs documentation are in pediatric ERs, in pediatric clinics, and in pediatric environments like in schools, daycares. I wanted to share with you a personal experience to bring the importance of ACEs home. What happened was there was a 5-year-old child who was discovered by her mom to be lifeless in her bedroom. The baby was taken to the pediatric trauma center immediately. The mother claims that her daughter had been acting abnormally for the previous few days, and that she had earlier that day discovered her hiding in the closet. When the child arrived, she was given Narcan immediately. We generally give Narcan to children who are lifeless like that, but have a pulse, because of the fear that they have ingested some type of medication and created a drug overdose for themselves. And in fact, this is what had happened. So once the child was medicated and made safe, the child was treated and then made and sent to the pediatric ICU. There, in the pediatric ICU, the child was diagnosed with depression and anxiety. When speaking to her mom, I didn't speak to her mom, but the police did speak to her mother. It was noted that the child had been sexually abused by the dad, and the mom was aware of it but didn't do anything about it. That's neither here nor there. We didn't punish the mother. We didn't know what environment that she had been in, but the child was our focus. And so the child, after being diagnosed, was provided counseling, and the mother was invited as well. She was provided counseling because you just want to get the child's coping mechanisms back in place. And we do that with constructive talking by a therapist. Additionally, a support group for kids with anxiety and sadness was recommended to the mom so that she can make sure that the child continued care in these places. The 5-year-old child discussed in the case study is not an isolated case. Children are at risk all the time. Examples of children who are at risk are those who've been exposed to, again, adverse childhood experiences. These children tend to develop mental issues, behavioral issues, and some even abuse substances like drugs, and they even start smoking and taking illicit drugs as well. The child discussed in the case study is not an island. She is not an isolated case. They are a risk for children who have been exposed to adverse childhood experiences. These children are at a greater risk for developing mental health issues, behavioral issues, and using substances that they should not. Like, for example, tobacco. Children who experience adverse experiences smoke, they use illicit drugs, and they drink alcohol. All these of which are not healthy for children and shouldn't be expected to be healthy for children. Concerning the case study, some of the traumatic experience history of the 5-year-old consists of, according to the mother of the child, the father had sexually molested the child, as we discussed earlier. The child has witnessed domestic abuse between her parents. The child has witnessed the police at her home protecting her mom but not herself. And according to the mother, the child has also witnessed drug and alcohol use daily. These are a lot of traumatic incidences that this child has experienced. So it is imperative that we find resources to help protect her. The hospital where the child was hospitalized started the process. For treatment, the child was subsequently directed to a program for treating sexual abuse. The response to that, the child was successful in the treatment and was able to process her experiences by going to weekly therapy sessions. These sessions were not paid by the parents. These sessions were paid by the child's insurance carrier. This was important because you can't expect parents to have money, and you don't want money to be the deterrent for a child getting the counseling that they need. The results, with treatment, the child's symptoms got better, and hopefully her experiences would not hinder her in school. School is an important factor because what's done at home generally can be acted out or seen or processed while in school. Children can be helped to heal from the trauma they have experienced and to develop healthy coping skills through early intervention and treatment. It is extremely important for a child's progress in the treatment to have the support and participation of her family as well. This information on this slide is about discussion, and what we discussed in the case study was a child who was subjected to a range of adverse experiences, which we call ACEs. She was subjected to sexual abuse at the hands of her father, witnessed her parents' engagement in violent behavior towards one another, and lived in an environment where drug and alcohol were present. Because of these events, ACEs, the child eventually developed anxiety and depression and an addiction to substances. The child received treatment in the form of medication, psychotherapy, and participation in support groups. After receiving the treatment, the child showed marked improvement in her symptoms. Now let's discuss the potential harm to children when they experience adverse experiences. The potential harm, not only with the child in the case study, but children can be bullied. Children experience these traumatic experiences when a parent has mental illness, when a parent is an alcoholic or she's living with family who uses alcohol daily. ACEs can directly harm any child, for example, if they experience physical, emotional, sexual, or verbal abuse and neglect. And ACEs can also indirectly cause harm because the experienced environment in which the child is living. This includes witnessing domestic violence or experiencing a death of a parent or a sibling. I put treatment in this oral report twice intentionally because it is imperative that those who experience children who have experienced trauma know that early intervention and therapy is imperative. Children who have endured adverse experiences need counseling. Children who have been exposed to ACEs have a greater chance of acquiring mental health issues as well as substance misuse problems later in life. And children definitely can be helped and heal from the trauma if they develop and learn through counseling and through the support of family, coping skills. But all of this treatments have to be taken upon early. I just wanted to conclude this oral presentation concerning ACEs with a session of what I call just real talk. The child in the case study was real. It was a very difficult time for me when I saw this child because I had never dealt with a 5-year-old trying to take her own life because of her life experiences were too traumatic to handle on her own. This leads me to say to all, if you know of any child who is being traumatized by their circumstances, please take a stand and speak out. Your words of concern could save a life.